Welcome to MitoCast by Mito Foundation. We share information and resources to support people with Mito, their families, and the wider community. All content is created by Mito Foundation. AI text-to-voice technology is used only for the production to make our resources easier for everyone to access.
Today we're talking about a topic that comes up again and again when you live with Mito: supplements.
This episode is based on a Mito Community Summit session with Dr Christina Liang, a neurologist at Royal North Shore Hospital and the Neuro Clinic at Prince of Wales Hospital. She works with people living with many neurological conditions, and she has a special interest in Mito and in the role supplements might play. And she knows how confusing this space is. There are lots of products, lots of stories, and not always a lot of clear evidence.
So in this episode, we'll walk through what Dr. Liang shared, what we know about supplements, what we don't know yet, and some practical ideas for talking with your health team and tracking what is actually helping you. Dr. Liang started by asking a very simple question. Who here is taking supplements? In the room, a lot of people put their hands up. Some were taking more than 3, some more than 5. And when she asked who was sure their supplements were working, many people were not sure, but were still taking them, which is really common.
She shared a study from the United States where most people with Mito were taking supplements. 3/4 of them were on more than 4 different products and spending a lot of money each month. The most common ones were CoQ10, L-carnitine, riboflavin, vitamin D, and vitamin C. Many people felt some symptoms improved, especially fatigue. Others felt no benefit at all but kept taking them anyway.
She also mentioned a Dutch study where people rated self-help strategies like massage, exercise, and yoga as more helpful than supplements. So you can hear the pattern here. Lots of use, lots of hope, but mixed results.
She then flipped the question, what do doctors think?
A survey from European centres found that around 95% of pediatric clinicians were recommending supplements to their patients with Mito. That is a lot of doctors, but it does not mean the evidence is strong. Dr. Liang was very honest. There are only a few specific mitochondrial conditions where we have clear, good quality evidence that a particular vitamin or supplement makes a big difference. And they are not the most common forms of Mito. In many other situations, the evidence is weak or based on very small groups. So decisions come down to weighing up possible benefit, cost, and safety for each person. She gave a few examples where supplements are clearly part of treatment. One is a condition called biotin thiamine responsive basal ganglia disease. Here, very high doses of biotin and thiamine can improve brain changes seen on scans and support symptoms. Another is ACAD9 deficiency, a rare condition that affects the heart and muscles. In a small study, treatment with riboflavin or vitamin B2 improved how one of the mitochondrial complexes worked and seemed to help survival. There are also conditions where high-dose biotin is used to treat seizures and skin changes, and scans can improve after treatment. The key point is this. In these rare examples, the genetic diagnosis and the supplement are tightly linked, and the dose is managed by specialists. They are not general recipes for everyone with Mito. With that in mind, Dr. Liang brought things back to basics. She shared a small study where people with more common types of Mito kept a 3-day food diary. Most of them were already taking several supplements. But when their intake was checked, the most common gaps were very simple things: vitamin D, calcium, and not enough fluids. She also reminded everyone about other basic nutrients that can cause big problems if they are low, like vitamin B12, folate, and iron. Low B12 and folate can affect the brain and nerves. Low iron can cause anemia and fatigue, especially for people with heavy periods or gut blood loss. The encouraging thing is that these can all be checked with blood tests and replaced in a targeted way if needed. So one of her strongest messages was to start with the basics. Ask your doctor to check common deficiencies. Fix what is clearly low before layering on more complex supplements.
She also spoke about being careful not to overdo some vitamins. Vitamin B6 or pyridoxine was one example. Most people only need around 1.5 milligrams a day. Some over-the-counter products contain 50 milligrams or more per tablet. Taken once a week, that may be fine. Taken every day for a long time, it can actually damage nerves. High-dose vitamin C was another example. Regular doses are usually fine, but very large doses, over several grams a day, can increase the risk of kidney stones in some people. And fat-soluble vitamins like A, D, E, and K can build up in the body if taken in very high amounts. So with all of these, more is not always better.
Dr. Liang also touched on L-arginine and L-citrulline in MELAS. She explained that L-arginine is used in some countries as an intravenous treatment during stroke-like episodes. It helps the body make nitric oxide, which can widen blood vessels. But the research is based on very small numbers of people. Different countries have different views, and long-term daily use is more controversial. L-citrulline might produce nitric oxide more efficiently, but again, the evidence comes from tiny studies. Her main message was that these treatments should only be used under specialist guidance, especially in emergencies, and are not general supplements to start on your own.
Then she moved on to the group of supplements many people know well, the ones with limited but interesting evidence, CoQ10, L-carnitine, creatine, and different forms of vitamin B3 like niacin or nicotinamide riboside.
Coenzyme Q10 is probably the best known. It helps shuttle electrons along the mitochondrial chain. Trials in Mito have been small. Some people, especially those with muscle-based symptoms, seem to notice mild improvements in exercise capacity. Others do not feel any change. Absorption is also tricky. CoQ10 dissolves in fat, so it is absorbed better when taken with a meal that contains some fat. Smaller capsules spread across the day may also absorb more evenly than one big dose. L-carnitine and creatine have also been studied in small groups and may help some people with exercise tolerance or short bursts of activity. But again, numbers are small and results are mixed. Vitamin B3 forms have been tested in very tiny studies in people with low NAD levels. Some early results looked promising, but newer research suggests the story is more complex, and there is not enough evidence yet to recommend them widely in Mito. So her advice was gentle but clear. If you are thinking about trying these, go in with eyes open. Know that evidence is limited, and always check for interactions with your regular medications.
She also gave some tips on choosing products. In Australia, medicines and many supplements have small codes on the label. A USTR means registered. The product has been assessed for quality and effectiveness for a specific use. Panadol, for example, is AUSTR. AUSTL means listed. The ingredients and safety are checked, but the product is not required to prove that it works for a certain condition. Seeing one of these codes does not tell you that something will help Mito, but it does help you avoid products that may not contain what they claim. She encouraged everyone to read the back of the bottle. Check doses of things like B6, look for overlapping ingredients if you take more than one product so you do not accidentally double up.
The last part of her talk was very practical. How do you know if a supplement is helping you? For most people with Mito, there is no simple blood test that changes when a supplement works. So Dr. Liang suggested treating each new supplement as a small N=1 trial. That means you are the one person being observed. You start by choosing one symptom that really bothers you. For example, fatigue, headache, bowel function, or how many stairs you can climb. Then you keep a simple diary for a while before starting the supplement. That gives you a baseline. After that, you start the supplement and keep tracking the same symptom in the same way for a few months. You then look back with your health team and ask, is there a clear change? Is it worth the cost? Are there any side effects? Mito Foundation has free diary templates on the website that can help you track headaches, activity, mood, and other symptoms over time. You do not need to use every form. Just choose the tools that feel realistic for you.
So, to bring it all together, supplements are common in Mito and can be very expensive. Only a few rare mitochondrial conditions have strong evidence for specific vitamins at specific doses. For most people, the evidence is limited and mixed, starting with basics like vitamin D, calcium, iron, B12, folate, and good hydration is important. Some supplements may be worth a careful trial, but always with your health team involved and always with a plan to check whether they are actually helping you.
If you would like support to think this through or want help using the Mito Foundation symptom diaries, you can visit mito.org.au or call our helpline on 1300977180.
You've been listening to MitoCast by Mito Foundation. To learn more or find support, visit mito.org.au or call our helpline on 1300977180. Make sure you follow MitoCast wherever you listen to this podcast to help us spread the word by sharing it with others impacted by Mito. Thanks for listening.